passionate about women's health. I have been in the nursing field since I was 18. Started out as a home health aide, hospital corpsman in the Navy, LPN, RN, and now nurse practitioner. Along the way, I've worked various areas, but the areas that I feel most passionate about are women's health. The uniqueness of our team is that we take the full woman into consideration, not just her hormonal issues, but all her gynecological issues and whatever other comorbidities that she has as well, and try to have an approach that addresses the full person and not just hormones, but definitely hormones. In menopause and even outside of menopause, anything before menopause is perimenopausal. All women are in a perimenopausal state because all women have estrogen and progesterone, testosterone, cortisol, DHEAS. And so whenever women come in with symptoms, one of the ways that we help women to overcome those symptoms is through hormone replacement therapy. And it's basically finding a balance for that patient, matching their hormone symptoms with the results that we get from saliva testing, because we believe that saliva testing is a more sensitive test and it looks at your overall bioavailability of your hormones. And we look at both of those and we come up with a custom compound to match that patient's symptoms if they are a candidate. When I'm not at work, I like to hang out with my family, but also hang out with my friends. Girl time is really important and very special to me.